Hi everybody, welcome to my channel. I'm Stacy and I'm a registered nurse. If you're new here, welcome in. If you're coming back, I'm so glad to have you. Let's talk about palliative care in conjunction with hospice and the differences and the similarities and how palliative is beneficial. Let's talk about it. And I would just like to say that everything that I say here is my opinion, my experience, does not replace legal advice or the orders from a doctor, an MD. So take what resonates and leave what doesn't, as the psychics say. So let's get into it. But if you like what you see here, then I ask that you like, subscribe, and follow for more. So one of the things that I have noticed about being a hospice nurse is that we are sometimes seeing people that are coming on when they are at the end of their life process. So maybe they're only on hospice less than a week or less. And I feel like, and I think that studies have shown that coming on to hospice sooner in your disease process will give you a better experience in that death and dying with that comfort at home. I think that one of the things that we don't talk about enough is the benefit of palliative care. Now, I have worked for a hospice company and I have seen other hospice companies that have palliative care and hospice in the same building. And it is not the same thing exactly. So palliative care is a comfort-based care. So patients are not seeking aggressive treatment necessarily. They are preferring more of a comfort-based care. However, if they choose to seek some aggressive treatment, they can. They can continue with certain treatments that they would like to continue, and they can continue to seek like physical therapy and things of those natures that I believe on palliative you can continue to seek those types of things. But what palliative does, hopefully, what I believe it's doing, is transitioning people in that people who have a diagnosis that says if your disease runs its natural course, you would have 6 months or less to live. Now, let's be real. We're living longer. We're finding ways to fight disease processes and keep a little bit more time on this earth and spend a little more time with our loved ones. We're finding ways to do that sometimes. It doesn't mean that the disease process isn't still happening, but some patients are living longer in their disease processes than 6 months, right? We know that we don't just come onto hospice and die within 6 months every time. There are plenty of times where a person does come onto hospice and they truly are at that 6-month window and they truly are gone within 6 months. But that is not the case for every disease process. This is not the case for every diagnosis. And so palliative is a way for a person to start getting their foot in the door, to start understanding the medications that we use in hospice. What is hospice? How can hospice benefit your loved one? How can hospice benefit your patient? I think we should start talking about it with our patients sooner. I think that primary care doctors and providers, PCPs, and healthcare as a whole should be introducing the concept of hospice sooner in the disease process. Now, does a person need to jump onto hospice if they're not ready? I say no, absolutely not. And I'll tell you why. Because if you come on hospice and you're not ready to be on hospice, you will probably revoke. You will probably go back to the hospital. You will probably come off of hospice. So my recommendation is start with something like palliative. If you know that you don't want to be going to the doctor every time, you don't want to be doing all of the things that you've been doing, and you're at that stage in life, these are the things that we should be educating our patients about sooner and helping them with sooner. If we can get a person into a hospice program or a palliative program sooner, then they're going to have a better experience overall. They're going to get better education. They're going to know what to do as things are coming about. You know, we have to be in the mindset of educating our patients. Yes, I know that we want to cure people, and that is our goal as healthcare providers. We want to cure people, we want to help them, but we know that some things are not going to be cured, and we have to start looking at the risk versus the benefit, and how is this really beneficial to my patient. I think we can't be looking at the dollar. And sometimes I feel that that's what's happening. Is that happening in every case? No, that's just my opinion. But what I feel is that we need to be talking to our patients sooner about their disease process, what that looks like as it progresses, what it looks like if they go on hospice, how palliative being in the home can help them. Now, the company that I worked for that I really thought was amazing, they had a palliative program, and that palliative program just transitioned into hospice so that the patient was already receiving our services and familiar with some of our people, and then they were transitioned over into that traditional hospice setting. And I thought that was amazing. And I really do advocate for a palliative program instead of hospice if you're not there yet. I love what we do in hospice. I'm really proud of being part of that. I think there's a lot of negativity surrounding hospice because people don't have the education that they need about what's happening in the disease process. People really go on what other people are saying. But if we as healthcare workers are educating our families and our patients sooner in their disease process about what heart disease looks like as it progresses, about what happens with our COPD as it goes on in time and it gets toward the end stages of the disease process. Because when we have a chronic illness such as heart disease, COPD, congestive heart failure, when we have something that is chronic, the likelihood that it's going to end lives is high. When is that going to come? I don't know. We are all dying, right? We are all born and we all die, and we don't know when that day or time is going to be. But I do think that there is value in providing better education sooner about the progression of diseases and where that's leading to and how that looks and what a timeline could look like for a patient so that they have an idea in their mind. We don't want to make people afraid. We don't want our patients to be afraid, but we want them to be empowered. We want them to feel like they have a choice on what this looks like for them and how that's going to be for them. I think that is what is important as healthcare workers, is that we are empowering our patients and giving them information and helping them through their processes. Because didn't we become healthcare workers because we wanted to help people? So let's help people. Let's help them. If we're in hospice, if we're in primary care, I think that we should be introducing those ideas to our patients as we see things progressing. Early on, when we start to see those signs, we know what those signs are. We know when there's a progression in a disease process, right? In hospice, I know when a person is getting closer to their death and dying journey. I know when that's getting closer based on certain symptoms, based on certain, things that go along with the disease process that they're in. And I think as healthcare providers, we also can look at our patients and say, you've had a lot of hospitalizations, you have had a lot of infections, you have had a lot of falls, you are doing these things that are precipitating progression of your disease. I think it would be worth it to talk sooner about palliative and bring palliative on board so that when a person does need to transition into hospice, that's a conversation that's been had. That's information that they've had access to. We have to give our patients information. And that's my soapbox. How do you feel about hospice? How do you feel about palliative care? What questions do you have about it? What things have you heard negative? What things have you heard positive? I'd love to talk about it in the comments. And if you like what you see here, then I ask that you like, subscribe, and follow for more. And I thank you so much for watching. And I really hope to see you soon. Bye-bye.